Hi there again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'd like to talk to you today a little bit about impacted teeth. We've had so many impacted teeth during my lifetime that I've just got so many pictures of them, but I'm trying to pick out the ones that are might be interesting to you. And this particular lady that I'll show you today had an impacted cuspid that affected the shape of the palate, plus a missing tooth on one side there that had some influence on it too. So we'll get in here and show this as a and move through it as quick as we can. I've got a lot of pictures on it, but I'm going to try to speed through this. I hope it's not too fast for you. Uh, Let me get this little arrow going here. And this is the palette that I was going to show you. I wanted to show you. The midline of the palette, you see, is going right straight up in this direction and heads off out here. And this side of the mouth is looking pretty good, but the other side of the mouth is a kind of a mess. And we've got a tooth missing right in here. Looks like a 6-year molar. And there are two buys here. And here's a lateral and a central. And there's a cuspid up in between these teeth right here. So we'll have to go in and push these back, and we'll move these over. And as we do, we'll tend to straighten this center of the palate out. I don't know what would do if you had to put a palatal separator on when it's crooked like this. It'd be a little different in there. So we'll just kind of watch this as it takes place. A nice lady. We went through this. She's about, uh, I don't know, she's in her 30s, I think. And this is 1988 when we did this. And here's a picture of their profile. That's a good facial height in here. And the face is divided up, in thirds, and it looks good. And there's no problem there. And looking at it from the front, we notice there's a good bit of difference in the size of the jaw from on the left side of the mouth and the one on the right side over here. There's a little difference, and the midline of the facial kind of tapers off in that direction. And probably this difference in this, well, I know it has some if you shape the palate there, then you're going to have some difference in the structure of the face on that side also. So let's get on here with this. Now the teeth look pretty good over on this side of the mouth, but you've got a real problem over on the other side. And the centrals have shifted the midline as well here. She looks like she opened hairpins or something with these teeth and kind of wore the enamel down. I don't know that that's what happened, but that can happen. And so we'll take a look at this side of the mouth. The right side looks good, except for this. Looks like a wisdom tooth, but no, just a second molar back there. Looks kind of dark from this angle. And let's go look at the other side of the mouth. And you see here's a central and a lateral, and then there's a bicuspid right in here. And then there's a 6-year molar that's missing in this area right here. and this is contacted, so we're going to have to open this and push this over in this direction to get this impaction down into that space. Let me go back here. I'm going to have to erase that. And now that's the same picture I showed you a while ago. Now this is where we're going to have to stick this cuspid. And the cuspid is up in this area, right in here. And so we'll come in, we'll have to put our orthodontic appliances and everything else. Now the bottom arch is lined up, it's just crowded down here, but we're going to expand the upper arch and we'll get room for these teeth to come in. This second molar back here looks pretty bad, but maybe they crowned it or something. Anyway, we stayed with it. Now here's, that was, I forget the date on that last picture, but we're in 1989 now. It's in March of 89. And we've lined all the front teeth up in here, and we've opened this gap. And this is where we're going to try to pull this cuspid down into this spot right here. And this midline has got a little better, but not a whole lot better. Now we're using this method of bringing impactions in that we developed several years before this, but it took a long time figuring out how to do it. But once we got it done, here is the gap now that's right in here. And you see this spring, this is a open coil spring that you wound on the arch wire. It's the one spring. It goes all the way from here to here that's pushing on those teeth. Now, right at this point where we wanted the cuspid to go, we take the arch wire and make a loop, something like that, and come on back here. And you can put a spring in there and just kind of wind it over this loop. Now we'll hook up another elastic, not elastic, but a spring back here in the back of the mouth, tie it to the last molar, going out to the back, and bring that spring forward. Let me get that back on that picture. And the spring will be coming from here, and about half, we put some dental floss on it and run the dental floss up through this hole and double it and go back and hook it to the cuspid, which will be way up in here. And this spring, you can put it up to 1 pound of force on that, and it stays. And it pulls the tooth directly where it wants to go, and it stays about the same 2 or 3 weeks. Later, it'll be almost the same, except if it moves the tooth forward, it will reduce that. And so we're going to show you a little bit about trying to get the hook that we put on the impacted tooth on there, and then we'll start putting this together. And that looks complicated, but if you'll go back and study the videos I've got on the impactions and the mechanics of it, it'll show you that in more detail. But that's the most efficient way I've ever seen to pulling an impacted tooth into the mouth. You have a constant force, it's pulling in the right direction, and it doesn't go up or down, and it'll be just as strong, except that as it pulls the tooth, it gets it closer here, so it reduces slightly, and you redo it from time to time. So let me erase that, and we'll go on to this. This is the other side of the mouth, and it all looks pretty good. There's no problem there. And here this is again. And now we put a step up arch in here, and that keeps this space open in this area for the bridge or whatever they put in here. And then we've got the two bicuspids, and now we've hooked this spring back way back here at this molar, and you use the spring right on here. You bend back a few rungs of the spring. I'm sorry, keep that poked up there. And we run the dental floss from here, and you tie it off, and it puts the same amount. You can figure exactly how many ounces of force you want to put on it. And this will stay open here, or we can open it wider, and with a step down or step up arch like this, you can direct the root structure if you want to, whether you want to push on it and have the root go back this direction or the other direction by how you do the little legs of this step up arch. So this is gets a little more complicated. And now they got this pressure here, which might be up to a pound that we're going to go up here and hook to that tooth. So now there's the palate has begun to change now, and we've got this. You see that circle we put on that, and here's the spring that opened this gap. Now this tooth right here was in contact with that. Now we made something to bond on to this spring, this tooth, and we come out here with a twisted wire, and we make our hooks out of 14 thousandths soft stainless steel wire, and you twist it up like that, and it'll take 4 or 5 pounds of force to straighten that thing out. And then you can hook that onto something, or you can make like you get when you go down here to do this surgery to hook this on, which we did a lot of that, and we cut this back with electrosurge and kept it cauterized so it didn't bleed, and we etched and washed the tooth, and whatever you got to down there, we would take a circle of that material and maybe bring and come out like that, and then we twist that up, you see, and make a hook out here. And then we would run our dental floss back into that and then back to this spring. And that's pulling this. The wax dental floss has almost no friction up here. So if you've got a pound of force here or 12 ounces or whatever you want, you would have virtually 12 ounces here, and it takes that tooth right in the direction you want it to go. So this is the most efficient way. Now I've got a video on that if you want to get in. I've got several cases of it. So let's get back over to this. Try to get this finished here. So it goes up this way. A lot of times we make if the tooth is real deep, we'll make a hook this longer. And as we get the hook up here close, we'll cut it off and roll up another hook and pill onto it till we get this hook right up here to this point. Then at that point, we're going to turn the tooth around and set it in there properly and put a bracket on it, which is normal for any type of impaction like that. All right, here's the bottom arches lined up. There's no problem with that. And, excuse me, I went past that. Now here this is, you can pull that tooth from 2 different angles. If you want to hook an elastic down at the bottom and go up and hook onto the tooth, but the patient has to put this one on. The patient doesn't do anything to this one right here. So if you've got a cooperative patient that wants to get this tooth in a little quicker, Now you can see this spring right here is one spring. This tooth, the bicuspid and the lateral were together up here when we started. So we're opening this with this spring and we're pulling this tooth in with this elastic and also over here. Now you do not have to have this elastic. This spring, if you tie it back at the molar and you pull it up this much, you can put a pound of force on this tooth to move it out. Now this step-up arch here keeps that space where they can put a bridge or an implant or whatever they want to in this spot right here, and we'll have this tooth brought in there. Now don't look at that and think, my God, that's so complicated, I don't ever get it done. If you kind of take it apart, it's not that complicated, and it is the most efficient way to put force on that tooth that I know of. I've never seen another method of putting force on an impacted tooth that is as good as this. And it will be a constant force, and it holds up, and it's the same 2 or 3 weeks, other than as the tooth moves, the distance that you're stretching this spring is less, so it gets smaller, but then you tie it over again when you see them, and you pull it up and put the same force back on it again, like that. And I have never found a cuspid tooth that you couldn't bring in. If you could get to the crown and hook something on it, you could bring the tooth into the mouth. So let's go on now. So that's another view of it. And you see this was tied back here. Then this up bend arch kept that tooth from coming forward. But as you pull on this, it pushes the whole thing forward some. And there it goes to that hook. And we kept tugging on that thing. And I've got several pictures of it in here. And here the other side of the mouth, and we've got the impacted tooth coming pretty much in. So we've started down here, we've got it going right to this spot. Now you have to get it up in here somewhere before you start turning the tooth around. Okay. Now it's coming on up closer. All right, we pulled it up to here. Now when I got up close here, we took this and we just hooked our stuff to this bracket. I used a bracket to tie onto the tooth. Now the tooth is sitting like that. We're going to have to turn it around, and you've learned how we do the rotation of teeth. You can hook that little elastic chain on this thing and rotate it, or we try different ways of rotating them, but it's not too difficult to rotate that tooth into place. And so here we're pulling on it from the back side. There's the spring and the deal here. I think I stuck a mirror in there to take that picture. And now there's the tooth is in place. Here's the cuspid, and there's this wire. So we'll close this up. And as you pull the tooth forward, the tissue around here is kind of inflamed. Everything you need to keep it as clean as possible. And after a few months, this settles down, and it looks more like a tissue on another tooth over here. But I don't think I ever did. Now watch here. Here is the palate going like that, and the palate was going out this, out to start with. So by putting this tooth and pushing these teeth in place, we change the shape of the palate, and we also change the facial structure on the person. You can't move this down here without changing the facial structure. That's not enough to really catch your attention. Let me go back and erase that, and I'll come back. So here, this is 1990, and we'll have to close that space up. And your root structure coming up in here, we need to keep that really cleaned out and get the tissue to come in and fill in that right there. Now the midline never did get exactly over to the right spot, but there's some two sides discrepancy in there. That's the right, and here's the left, and we got this space now closed up in here, and this is still open for that whatever they want to put in. At this point, the palate is real straight, but I think as we go through a few years, I think we show this in 92, and this kind of comes back a little bit on there. All right, here we look at the x-rays. This is hard to see right here, but that's the impaction. And here's the lateral and the bicuspid. And we're going to put the tooth in this gap right there. So we start pushing this here and pushing this there. And to keep from closing this, we use a step up arch. Sorry, this came up across here, and it can't close this anything. But this is what we do. And we took the x-ray and drew in there what we were going to do. And I've got a few x-rays of that, and we'll try to see that. Now there it is. That's what we're going to put the hook on, and we've already opened this the space. Yeah, this is the lateral, this is the bicuspid, and they were together, and it's open. And now, and this is coming like holding these teeth apart. And as we push on this, it pushes this back too, and pushes this whole thing to the front. And now we're hooking the spring to this, and the arch will come out in this area and have a little deal. And we bring it under, we can pull that there. So that's kind of the way you do something. This is 1988, and here it is. We've got this tooth down to this point, and we'll let this lateral roots tilt over this way as we slide that either over the front of it or the back of it, one or the other. And watch, we'll get a little resorption of the root there, but not a great deal. Now the cuspid is coming. This is a bad x-ray. And now it's down in place. And here's the central. And there's the lateral. You see it's got a little bit of root damage right there. But we got it in and got the cuspid lined up there. And here it is in 1990. And this is 1990 again. We got to get this thing closed. And this is the case after we finished up with that. And you can see that here's the central, the lateral, the cuspid, and the two bis, and that gap is right in here. Now the root of the cuspid is still not as good as one you drag up there like that. We try not to mess with the attachment on it. We're trying to pull from the top of the tooth up, something like that, if we possibly can. It's like towing a boat across the water or something. So here's this deal, and this is lines up pretty good at this point. Here's the retainer, and there's the lower arch, and this is Our Lady. And we've got a pretty good set of teeth in there. There's 1992. We need to do something with that chip place in there. The midline is still off a little. It's kind of moved back some, but that's 92 after we finished it. And there, that cuspid, let me see if that, yeah, there's our cuspid and the two eyes and the gap between there. So that is the end of that one. And we put a 3-to-3 bonded retainer on the lower, and everything looked pretty good. And I hope you picked up something from this as to how to do this. We've done so many impactions over the years. I've got bukus of patients that we've extracted cuspids. I didn't extract them. I mean, I put them in place. So hope you're doing fine, and we would like for you to join our group and subscribe to our channel, and we'll see you next time. So I'm going to try to close this out, and we'll